Thank you, Madam Chair, and good evening, everyone. So my report was in the package. I do want to hit some highlights, though, for everyone this month. This past October has been very busy, lots of exciting things that have been happening. Under our strategic direction of strengthening the processes that drive a culture of patient safety and quality of care, I want to highlight the work of Dr. Colvin Springer, who's one of our highly respected physician and radiation oncologists, and has really dedicated his career to the care of our community. He actually performed the first brachytherapy procedure in Windsor, Ontario, 25 years ago, this past October 31st. So brachytherapy for our community members is an internal radiation therapy that treats prostate, breast, head and neck, and other cancers, where doctors place tiny radioactive pellets inside or next to the tumor, and they give off radiation that destroys cancer cells, and that treatment spares surrounding healthy tissue and organs. So Dr. Springer really helped to transform our prostate cancer treatment program at Windsor into one that's very highly regarded and recognized both provincially and nationally. So sadly for us, Dr. Springer recently announced his retirement, and we're going to miss his expertise, professionalism, mentorship, and excellence in clinical care and training. But we do wish him all the best in his well-deserved retirement. So thank you to Dr. Springer. Also exciting for our cancer program this past week, we've been installing our new LINAC bunker. So that's our new linear accelerator. And the final piece was delivered and installed successfully just the other day. Some of the changes with our season upon us, our fall and winter respiratory season, we did update our masking policy effective Friday, November 1st. So that requires masking within 2 meters of any patient, and highly recommended for visitors and patients that are in waiting rooms and lounges that are in high-risk areas, such as our dialysis emergency department and the cancer center. Excuse me. And of course, we also support anyone that wants to wear a mask at any time. Under our upholding principles of accountability and transparency strategic direction, I'm going to be highlighting shortly our new strategic plan that'll be kicking off in January 2025. Under a responsive and sustainable corporate financial strategy, we had a very generous donation from some of our community partners that have been raising money for us for a number of years. In fact, they've raised over $78,000 for Windsor Regional Hospital. So this is the Ahmadiyya Muslim Elders Association. So they raised $30,750 with their fun run this year in Malden Park. I believe they had over 500 participants, and that's a fun run with a 1.5 kilometer fun run and a 5-kilometer race. So thank you so much for the support of the hospital. They've been great partners over the years. We had a great event for our critical care staff this past month as well, with over 70 participants. We had a great training program involving leading experts in critical care, nursing, respiratory therapy, pharmacy, and many more disciplines, and also looking at our current technologies and services supporting ICU care. So that was a great event. Working collaboratively with our external partners, strategic direction. Of course, we had our recent Code Silver exercise. So you might have seen that in the news. So we had our Windsor Police Services partners, as well as OPP, EMS, Windsor Regional staff, and many others. Exercise was very successful. We had great participation, and that was really testing our response to a person with a weapon. So unfortunate that we have to practice those things, but we want to be well prepared in the event that that happens one day. Strategic direction, continuing the pursuit of the new state-of-the-art acute care facilities. So we've been continuing to work on our stage 1.3 submission and working steadily with the Ministry of Health and advancing that project. We are gearing up for stage 2, which is our detailed design work that we're hoping to start in January. So we'll be pulling together our user group members again to really start providing input into a number of critical decisions, including our day-to-day hospital operations in the new building. And we want to ensure that there's meaningful and relevant participation from all key individuals. So we will be working on an engagement framework to reach out to people and make sure that we've got the right people at the table. So keep an eye out for that. Happy to answer any questions before I move on to the strategic plan, if there's any questions with that report.
Thank you, Karen. Nadine?
Sorry. Thank you, Karen, for your report. I did have one question about the Code Silver. Any key takeaways from that? Because I believe that was the first time you were doing this exercise with all of these partners.
Yeah, it was the not the first Code Silver exercise that we've run, but it was the first kind of, let's say, live action
Yeah.
Code Silver that we've had. Prior, we've run tabletop exercises. So we did learn a lot. We are just in the process of pulling all of that information together now. Anytime we run an exercise, we always learn a lot. We could run another exercise in a month and we would have more learnings. So I know that we were able to test out all of our processes internally. It was a great opportunity for our police services as well and our other emergency responders to participate and also practice using all of their equipment and also get used to our building and the idiosyncrasies there. So a really great exercise, and we'll bring more back from a community awareness perspective in the coming month or so.
Thank you.
Yeah,
Great.
absolutely.
Thank you, Karen. Thank you, Nadine. We look forward to hearing more. And Anthony, you have a question or a comment?
Yeah, just a quick comment. I just want to reiterate just the exceptional job that Ahmadiyya Muslim Elders Association put on for the Run for Windsor. I have never seen an event like that put on by a group of individuals. It was one, inexpensive, family friendly, and the turnout was spectacular. So kudos to them. I took part this year, and I've already marked it on the calendar for next year. It was truly spectacular. They put on a great show. So, Karen, thanks for bringing that up.
Yeah, absolutely. And they do great work across the globe, really. They have many, many members that work nationally, internationally, and across the globe to support various initiatives. So we're very grateful for their support.
Thank you, Karen, and thank you, Anthony, for that acknowledgement. Any other questions for Karen or comments before she goes on? Okay, Karen, you can keep going.
All right, I'm going to just share my screen here, so just bear with me. I practiced earlier, so it would be seamless. Ish. There we go. All right, so we've been talking the last couple of months just about the progress over the summer with development of our new strategic plan. So the strategic plan will kick off in January of 2025 and take us through almost to the new hospital. So we're very excited as we're able to mature and develop our previous strategic plan, and I'm going to share those results with you this evening. So just a refresher on the process. So we formulated a committee earlier this year. We had representation from our patient family advisory committees, our union leadership, our medical advisory committee, many professional staff, our board members, and leadership from across the organization. We conducted environmental scans, did many surveys. I think we had the most survey responses of any of our historic strategic planning sessions. And reviewed all of our guiding documents. So whether they're provincial guiding documents, national guiding documents, best practices, etc. So we had 3 meetings over the summer of the larger committee. The first one was an overview of the approach, including our SWOT analysis. The second meeting involved a review of our vision, mission, values, strategic directions, and initiatives. At that point, we struck a working group that did the detailed work, a whole lot of work. They were very impressive on our vision, mission, values, and our strategic directions and initiatives. And those were brought back at meeting number 3 with recommendations that then went on to the governance committee for review and recommendation and then approval at the board. So we had a fantastic participation. We had over 70 individuals that participated over the course of the summer, helping us pull that together from across the hospital and the community. So thank you very much for that. So our vision, outstanding care, no exceptions. So our vision statement really describes the hospital's aspirations and long-term goals. It's a compelling vision statement that inspires our stakeholders, motivates our staff, attracts patients and partners who share similar values and goals and provides us with direction, a sense of purpose, and guides our strategic planning and resource allocation. This has been our vision for the last cycle. It's very well known to our staff, community, and partners. And the recommendation was that our current vision remain unchanged. Our mission, providing quality patient-centered healthcare to our community. So our mission really provides the fundamental purpose and reason for our existence. It communicates what the hospital aims to achieve in terms of healthcare delivery, patient care, and community impact. And we kept our mission the same as we progressed towards the new hospital. Our values. So there was a lot of discussion as we reviewed our values, and we really wanted to ensure that elements of EDAR, or equity, inclusivity, diversity, and anti-racism were incorporated into each value based on the feedback we received from all of our partners that contributed. So our overall mnemonic of compassion, accountability, respect, and excellence stays the same, but we've built into those value statements equity, inclusivity, diversity, and anti-racism principles. So under compassion, we show understanding and humility through equitable care for patients and each other. We listen to our patients, their families, and caregivers throughout their healthcare journey. And in every interaction with people in our care, we have an opportunity to show empathy and kindness, recognizing each individual will have their own unique experience. We are transparent about the care we provide to the community that we serve by fostering an environment where independence, confidentiality, and dignity are demonstrated at all times to everyone. We honor our commitments by taking responsibility for our actions. We treat each other with dignity and maintain trust as the cornerstone of providing equitable care. We collaborate with patients, families, caregivers, and the community to deliver inclusive care. And we respect the autonomy of patients to make informed care decisions reflective of the diversity of our community. And lastly, we embody an inclusive culture focused on quality and safe patient-centered care. We embrace change and innovation with a focus on evidence-based best practice, and we foster dynamic partnerships by encouraging research, learning, and diverse knowledge sharing. And then into our strategic directions. So similarly, our strategic directions have incorporated EDAR principles. So the first direction is strengthening the processes that drive a proactive and inclusive culture of patient safety and quality of care by leading in the development and integration of standardized best practices to achieve quality care and outcomes reflective of the diversity of the community, leading in the development of patient safety initiatives and measures in collaboration with our community partners, and leading in the development of strategies and practices that support timely, flexible, sustainable, and equitable access to care. Number two, fostering an inclusive culture of accountability and transparency, utilizing and sharing results from performance indicators to achieve excellence, promoting safe and inclusive care through a consistent, fair culture of accountability, using the just culture and ethical frameworks, strengthening the systems that clearly identify, support, and measure accountability throughout the organization. Number three, maintaining a responsive and sustainable corporate financial strategy, providing quality, equitable care in the most cost-efficient way while maximizing revenue and funding opportunities, providing ongoing education to the organization and community as to how the hospital is funded by the Ministry of Health through its funding formulas, identifying and implementing best practices within financial realities, monitoring and updating long-term strategy for funding capital spending needs, and maximizing the use of our current facilities to provide the best possible patient care with existing resources. Number four, enhancing an equitable workplace culture that establishes Windsor Regional Hospital as an employer of choice, fostering a respectful, safe, inclusive, and collaborative work environment across the team, building capacity to enhance a sustainable and diverse workforce with a focus on talent acquisition, retention, and succession planning, and developing strategies to nurture a healthy and engaged workforce that is reflective of the community we serve. Number five, enhancing collaboration and strengthening partnerships to build a better healthcare network, collaborating with partners locally, nationally, and across the globe to deliver an innovative, inclusive, and seamless system of care. Strengthen the opportunities for education and evidence-based research to build an academic healthcare system that attracts and retains professionals from all disciplines. And lastly, design and deliver a new state-of-the-art acute care facility with the community for our region. Design the facilities to meet or exceed the standard related to healthcare facility planning, engineering, accessibility, and design. Ensure the design incorporates leading edge and inclusive practices, technologies, and equipment. Design the facilities to support excellence and innovation in healthcare research, health equity, and education. Ensure effective and meaningful participation of employees, professional staff, volunteers, patients, external partners, and the community. And support the Windsor Regional Hospital Foundation to progress the plan in place to raise funds required for the state-of-the-art equipment and technologies needed in our new facility. So over the course of the coming this month and next month, all of the departments will be developing their operating plans that will be launched in January with our leadership team and board. And we're looking forward to commencing that work. And that's the end of my report.
Thank you, Karen. Any questions or comments for Karen as it relates to the strategic directions? Cindy?
Yes, I'd just like to comment that the strategic directions, the meetings we had facing and going and revising and modifying and sometimes keeping things the same were excellent with input from all across the board of Windsor Regional Hospital, our community leaders, patients, people that were on our PFAC groups. So it was very well done overall with all people involved. Thank you.
Thank you, Cindy. I agree. I think the 2 meetings I went to, it was standing room only. So great participation, and thank you, Karen, to you, the staff, and thanks to the community and the board for their engagement and participation. So I'm assuming, Karen, we will get an update in January or February, once the internal folks have had an opportunity to operationalize them.
Yeah, absolutely. Like I said, we'll have those operating plans completed by the end of December. And then they will go for presentation in January. So we're
Perfect.
excited about that.
Okay, thank you.